Well, it is a packed house today, isn't it?
It
Hello,
is.
everybody.
It's rare we get this many people.
Yeah, not all at once anyway. So, Dr. Paul Gittens and Cindy Tannenbaum, how are you guys doing today?
Cindy? Well, I'm doing great.
We're good. We're happy to be here. Thanks for having us on.
Oh, man. It is our pleasure for sure. Where are you guys, by the way, physically?
Well, I'm currently I'm in Philadelphia.
Okay, cool.
Oh, you're not too far from us.
Yeah, we're in Baltimore, so.
Oh, all right, right down the street.
Yeah,
you guys are having a good football year. If you guys watch football, you guys are having a good year down there.
Yes, it is quite the religious experience here.
It is. We actually took a planned loss this last weekend.
Yeah.
I'm hoping my Eagles did as well, so we'll see. We'll see what happens next week.
Oh man, I got some really good. Half of our fantasy league is all over the Eagles, and it was a tumultuous end of season in that camp. Man, they were not. The mood was not airy or light. They were very upset.
Yeah, we're crossing our fingers up here.
Yeah, gotcha. And Sydney, are you in Philly as well?
I'm in New York City.
Oh, okay. Right. My previous home before Baltimore, I was in Hoboken for a decade.
Me as well. I was on the island.
Yeah.
Awesome.
Yeah. Awesome area. Cool. Well, listen, guys, I want to get right into this. So thanks for coming by. But Dr. Paul, you want to just kind of give us a little background on this? What got you into this? What, you're passionate. Yeah, you're a passionate guy. I'd love to hear a little bit how you got here.
Yeah, of course. So I'm a board certified urologist, and after urology, I did a fellowship, which is specialized training in sexual medicine. And so that's what I focus on in my practices currently. So I focus on male sexual dysfunction, female sexual dysfunction. I also have a specialty in male infertility. So if you guys know, when a couple that's having some difficulty with having children, most of the effort is placed on the female, and the guy's usually forgotten. And so I really help the guys try to obtain fertility. And so we try to increase sperm counts, or we help with the IVF process. So
that's amazing. That really is. So I'm an acupuncturist, and I see about a quarter of my practice is infertility, and it's almost exclusively females. And we have a large chain of fertility centers down here. And it seems like once it's the male's problem, the fertility center washes its hands of the place, right? They're not offering any. No, you guys are on your own. See you later. So it's nice to see that this is a specialty that at least some people are looking at.
Yeah, it is. It is. So it's about a third. So my practice is about a third female sexual dysfunction. And for female sexual dysfunction, we treat women that have low libido, problems with orgasm, pain with intercourse. And on the men's side, we treat guys that have ED, low testosterone, issues with ejaculation, pain with ejaculation. Anything you think of, we treat for the most part.
So random question here. Why is that? Why are the dudes left off of this? Like in Tom's practice, and you're nodding your head when he's saying this. So I assume this is a secret that I don't know about, but what is there something driving that? How come that is imbalanced?
It's one of the things where I think that over time, women usually have sought fertility care before men, right? And so the guy's kind of in the background, and the woman, and this is a generalization, but a lot of the times the women are more proactive about going out and looking for fertility specialists. And guys are kind of just left hanging, sort of all right, whatever, you go first. And if there's anything wrong, I'll come in afterwards. Right.
Are you trying to suggest that my wife, when we were trying to get pregnant, did not go out and acquire an encyclopedic volume of information? And I was like, yeah, that sounds fine. Yeah, let's do that.
Dude, Doc,
I'm trying to suggest our effort is different in this regard. That is crazy.
Do you think that's a generalization about maybe the genders across the board? Because, the first people to come to me are always the females, and the men will sit there with a broken arm and go oh, it hurts like hell, but I'll shake it off.
Of course. It's a big generalization, but it's mostly true. If you see who drives healthcare, And in a family or in a partnership, it's usually the women that do, right? It's the women saying, "Hey, listen, you got a problem with your penis. You need to go see Dr. Gittens." Or,
oh, that's a shot in the ego.
Yeah.
Right. Or it's a woman that's saying, "Listen, you may have diabetes, or it's time to get your colonoscopy." As guys, we just don't, for some reason, we just don't really think about that stuff, and it's a generalization, obviously, but I think it holds true in a lot of different forums.
Yes. Like across the board. Yeah, no, 100%. I mean, I have a podcast on health, and I still have a trouble going to get my stupid physical once a year. And my physical's fun. I actually we've had podcasts about it. It's like a 4-hour executive physical. It's it's like Disneyland for half a day, but getting me to that office, it's impossible.
And don't mention the prostate exam to most guys. They're running out the door as I'm putting my glove on, and so, but that's kind of the way it is. And I think things are changing. I think a lot of guys are becoming more proactive about their health. I think, if I look at like my uncles, right, and I look at my my colleagues and their kids that are growing up, they're much more proactive than we were. So I think that is gradually changing, but it still remains to be seen.
I'm in a network called MDVIP. It's like a semi-concierge type network, and as fast as they can add MDVIP doctors down here, their practices are booking out now. And it is almost the numbers. I would be curious to know the actual numbers, but both talking to my doctor and tangentially for who's in the waiting room, it leans heavy male, like very heavy male, that are signing up.
When they call it executive, it sounds very male. You expect the old world leather chairs and cigar bar.
Yeah, but to your point, Doc, that's like these are men who are taking. I mean, there's a not so free charge associated with it. And it's like a whole, like I said, the physical's 4 hours long. There's a commitment there. And even with all those barriers to entry, guys are overwhelmingly signing up for it. And like I said, they're filling out. Your new MDVIP doc opens up, you have to jump on that like that day because people are snatching them up. I think they cap their the reason the system works, they cap their thing at 600, their patient at 600. So you can't have more than that.
Yeah, and you're seeing a lot of that even across the country in terms of like more concierge medicine. I mean, I think that speaks to. I mean, it speaks to kind of the discontent, I think, with our healthcare system. I mean, this goes way beyond this. We could talk about this for a long time.
Sure, yeah, no, for sure.
Just the combining of healthcare systems and guys waiting for patients just waiting to see their physician and getting to spend, 30 seconds with them, and then they have to move on. So it's hopefully it's going to sort itself out. I hope.
Yeah, no, we'd spend a great deal of bandwidth on this show talking about that in various times, but it comes up with almost every guest we have, no matter what they're talking about. This topic comes up recursively. So, definitely not new to just this here. So, all right. So what is it about that? What drives you keep going on? I mean, this seems like a growing field, no pun intended, in the sense that if men are taking a more active role in it, like that must be exciting. A bunch of new patients in the field. I mean, but I think it's something that I don't really, maybe this is because it's not around in the common conversation, but I don't have a lot of information. I know what a penis pump is, for example, but I honestly have no idea what the physics of it are or why you would use it or what you would get out of it. Just basic things like that I'm like, I never thought to ask and nobody ever told me. So I guess here we are. I don't.
Yeah. I mean, that's a great question.
It's just stuff like that. I'm like, how do you start this journey if you're as a guy, you know what I mean? There's so many questions. Where do you start if you don't have an acute problem?
Let's say, what is the driving force for that person to seek out treatment,
Yeah, so when the guys see me in my office, I see them for a number of different things, and one of the things that I see them for is erectile difficulties, right? And I like to say erectile difficulties because I hate the word erectile dysfunction. It just makes
it's
it
a
seem
tough word.
Yeah, it's a heavy
Yeah,
bag.
it's like,
Yeah,
Yeah.
your ego's already taking a bath right now. You
Yeah,
don't
your
really,
ego's
let's just
taking-
pound that in.
Exactly. It's like you're coming in tail between your legs, heads down, and it's just so I like erectile difficulties because I think it describes it. I think it describes it better. It's because guys can have problems on so many different levels. They can have problems with just starting, difficulty starting the erection. They can have problems kind of keeping the erection. They can have problems where they're like, they're having intercourse. They kind of go up and then they go back down and then they go back up and go back down, and so I like to say erectile difficulties because of those reasons. And so when we're talking about penis pumps, we're talking about erectile difficulties for some guys, but we're also talking about it being proactive for other guys. So going with the erectile difficulties portion, guys come in, they're coming in with some kind of complaint. And what I do is I do a full workup, obviously. So I'm checking their hormones, right? We're doing a physical exam. I'm checking their nerves. We do an ultrasound to look at their blood flow. I mean, we're doing a whole workup on these guys. And these guys, they seek me out because I believe that, they believe that I'm, and I know we're doing a great job. And so from there, after we get all that information, we then kind of devise a plan for them, right? And so if you have severe ED, right, if it's really bad on the ultrasound and so that person might need an implant, right? If it's mild to moderate ED, there's a number of things we do, and obviously there's some oral medications. We do, low intensity shockwave therapy. We use PRP. We use Botox. There's a number of things that we use on and off label. But a portion of one part of that is what we do is we try to exercise the penis, right? We want to make sure that we're getting enough blood flow to the penis. The penis is a vascular organ, right? And circulation is extremely important. And so usually, regardless of the direction we're going in, we're talking about exercising the penis and really increasing that blood flow. And one of the ways we do that is with a pump. Right.
Gotcha.
And so with the pump, so we're doing, what's that? You got,
no, that makes sense. Okay. So it's stimulating circulation to some degree, I guess, or entirely.
All right. And I got a question once you finish up there, because I please keep going, Doc.
Exactly. So, if it's a guy that comes in that had prostate cancer and they're having some ED issues, if it's a guy that has like mild ED, say, he's starting Viagra, or if it's a guy that wants to work on some of his these preventative things that we do, then I think a pump will fit in to all those different situations.
Now, how much? Because we're talking about blood flow here. How often do you see this is a symptom of a bigger, like say, cardiovascular issue or a systemic issue? Yeah. So with ED, we always assume that it is in some degree, right? Okay.
So we do know that guys that have ED, if we look ahead 10 years, 5 years, then they're more likely to have a heart attack or a stroke, right? Than a guy that doesn't have ED. So it's actually an independent risk factor for cardiovascular disease.
Wow.
If you look at medications, and you follow medications over time. So say there's a database at CVS or Walgreens and you follow medications, you'll see guys will start to get prescribed Viagra or Cialis, and then comes the antihypertensive medications, right? And then comes the high cholesterol medications. So you see that it's sort of like that litmus test, the canary in a coal mine, that has that's kind of telling us what's going on with the rest of the body.
Wow.
That was the phrase I had always heard, right? Vasculogenic ED was a canary in the coal mine for, all kinds of atherosclerosis and all this other, it was a laundry list. I mean, it was like everything. And I was like, wow, that's interesting. So that was, I don't know if I never fact checked that, but I had heard that years ago. Yeah, it's pretty interesting. With guys that have ED, and you talk to them long enough, you can usually find at least something that could be causing it. But we know, in terms of trying to prevent, exercise is great. That's always one of the recommendations, is changing lifestyle and changing a person's diet. Those are big things that we harp on, because
we know, like, obviously I'm focused on the penis, but I'm really a men's health doctor. So we're focused on the whole system,
Well, especially if you have a problem presenting in the penis, that like to Tom's point, I mean, it could be a number of things.
Anywhere
it could
else,
be
yeah.
anywhere else. That's just sort of like the end of the line. But
so I know we're circling around all this. You mentioned shockwave therapy. Now I've seen in the last maybe 3 or 4 years, maybe not a whole bunch, but a couple of different at-home devices. What are your thoughts on those? And maybe you could give a little rundown of shockwave therapy too.
Yeah. So shockwave therapy essentially is it's a therapy where there is acoustic or shock waves, and a shock wave is a high peaked wave, and then it dissipates really quickly. So what it's doing is causing like micro trauma in a good way to the penis. And there's a number of different types of shock waves. So there's radial shock wave, right? And radial shock wave has this kind of lower amplitude wave. And there's focus shock wave. And focus shock wave is really where all the data comes from. It's that high peaked wave that we want. And when you look at focus wave and you look at radial wave, focus wave in the literature is much better. There are some things that you can order online. And you got to understand, because you're ordering it online, the energy is not going to be as high as something that you're going to get in the medical medical office, right? Because you're doing it at home, right? And if it's going to be approved, it's going to be kind of on a more of a safety thing. Where the focus and the radio wave are waves that you're only going to be able to get in a medical office.
And what's the difference between the shockwave and like just a regular ultrasound machine? Like I've got, and again, I've got a home version of it, but when I'm a average triathlon guy done, and I have an e-stim unit and a ultrasound just for post races when things get a little hitchy. But is that ultrasound not the same kind of wave?
Yeah, the energy is totally different from a shock wave. Yeah, it's a much lower wave, and it's not going to cause any micro traumas, which is we want. So when we talk about micro trauma, we're talking about more of restorative therapy, right? Because what's going on is that the shock wave stimulates the tissue, right? And then the tissue, because of the micro trauma, releases all these growth factors and all these stimulatory cells where the body says, all right, I'm a little damaged. So what I'm going to do is come in now. I'm going to heal that. I'm going to increase the blood flow, the blood vessels. It's going to cause angiogenesis. It's going to increase nitric oxide. It's going to do all these great things to then stimulate the penis to be able to have a better, and what we're talking about, have better erections.
Yeah.
And so it's the same thing of, for instance, like if you, like for patients for their face, right? They'll use laser on the face to produce collagen, right? It stimulates collagen, but you have that micro trauma that's doing that. So a lot of women will have, laser therapy, or they'll do like dermabrasion of some sort just to stimulate the collagen in their skin. So we're doing the same thing for the penis with the shockwave. And so, as I mentioned, there's two types of shockwave. We have the focus shockwave. We have something called core wave therapy. And so core wave therapy is only can be delivered by urologists, and it uses focused shockwave therapy. And there's like protocols and everything that we use to try to get good results for that.
Is there sensation on that? Like, is it hurt?
Yeah, is
like,
it painful?
I mean,
Matt and I both immediately like, is that going to hurt?
Well, you say focused shockwave on my penis. I'm like, can we just talk about that real quick?
I like to call it gentle wave. No.
Yeah.
But so it doesn't hurt. So usually, when you look at the two waves, the radio wave, most radio wave machines, the way they work is there's like a ball and like a piston, and there's like so you feel kind of like a jackhammer, right? Because the ball hits the piston and it stops at a fixed point.
Yeah.
it stops at a fixed point, and that when it stops, you kind of get a little, it's a little uncomfortable. So for a number of the radio machines, you have to, a lot of guys will numb the penis with like a topical. But for the focused shock wave, you don't have to. The focused shock wave is, it's electromagnetically, it's the one that we have. So there's a magnet and there's this like water interface, and then the magnet kind of vibrates back and forth, which creates the shock wave. And so there's no pain.
That's funny. That's the exact opposite of what I would expect. Like the focus one would be more sensation, and but it seems
it's less
opposite.
sensation, but it's more. It works better because of the higher energies.
So
So
is your penis in water then? Is that what you're saying?
no, it's not in water.
Okay.
No, it's the machine. It's the machine.
Oh,
that
so it's enclosed within the machine.
all
Okay.
enclosed within like a handpiece. Yeah.
Okay. All right.
So when your guys are looking for shockwaves, they should definitely look for the focus shockwave. And so there's a number of companies out there, and it's just an easy question to ask: is your shockwave, is it focused or is it radial? And you really want to be guiding your guys to more of a focused machine.
Okay,
So-
I got a weird one here. Now, we got into this when biohacking was starting to rise and it was really becoming the new thing. Now, I've seen several people that claim to be optimized. They're spending hundreds of thousands of dollars on their personal health a year. They're showing up at a urology office to get shockwave therapy. And in my head, if they're truly healthy, why would they be doing that? So I guess my question to you is if they're, low body fat, super active, do a lot of cardio, every aspect of their life, they meditate, they eat right. Why would they choose getting shockwave therapy?
Well, I mean, even though I had mentioned before that, guys that have ED, those guys may have associated like medical problems. Not everyone has an associated medical problem. I have guys that have run like, these marathons, and I think there's like a big 5 marathons. These guys are in tip top shape and they still have erectile difficulties for other reasons, so maybe they're coming in because they are starting to have some issues. But in terms of low intensity shockwave therapy or core wave therapy, it's not FDA approved for ED, but we still use it off label, right?
Okay.
And we're using it for guys that have ED, but in the back of my mind, and what we use it for as well is are guys that are getting close to saying, hey, listen, like, my erections aren't as strong. I don't need Cialis, but I don't want to go on Cialis.
I
right?
gotcha.
So we'll use it for those guys to kind of push them back, right?
Is there an age kind of component to that too? Is this something we see as we age, or is this really all over the place?
Yeah. So for erectile dysfunction, it's more common as you get older, right? Yeah. And so, the rates are like 40% of 40-year-olds, 50% of 50-year-olds, and it just goes up from there.
Okay.
But, today in my office, I mean, I had a guy that was like 23, I had a guy that was 75, I had a guy that was 50, another guy that was like 19. So, it affects all guys, and the reasons are different for all those men, right? The older you are, then it's going to be more likely it's a medical condition, not necessarily, but it's just more likely the younger you are, then we're talking about some adrenaline mediated erectile dysfunction.
Okay.
But they can also have medical problems or hormonal abnormalities. Like the guy today I saw, his testosterone was extremely low, right? And so, for him, we're going to try to stimulate his testosterone in a good way, because don't forget, if you increase testosterone in a young guy and you give them testosterone, then they're going to lose their fertility potential, right?
Yeah.
Their sperm counts will go down. So we have to carefully.
What are you doing, like an HCG protocol or something like that?
So we'll use, it depends, but we'll use like Clomid, HCG, any of the formulations that doesn't shut down the system.
I gotcha.
So it really depends on the guy and their lifestyle, right?
Makes sense.
What they do for a living. It's, if somebody comes in and I've been doing this for a long time. And so, for your listeners and for you guys, it's like if somebody has just one protocol for everything, that I would run from that person, because you have to be able to incorporate so many other things, like their lifestyle, like, if they're married, if they want to have kids, all these things are so important. So when you have guys that have the protocol, you do this every single time, then I just don't think you're listening to your patients. Yeah. Or you only have one trick, and that's the only trick that you push it out there. You're a one trick pony, which I don't think is the right thing to be.
So what do you think? And that's an amazing point, right? You don't just want to look at everything as a nail and all you're holding is a hammer. But what do you think about guys that maybe don't have something wrong? Can they see benefit from this therapy too?
Yeah. So even when we're talking about, you mean for shockwave? So
Shockwave or anything you're talking about right now?
Yeah, I was
Yeah,
going to
so-
actually, just as a bolt onto that, is there a prophylactic course of treatment that you can just take like routinely
Like
every
we're
decade
asking for
or
us
whatever?
right now, if you can't
Yeah.
tell.
Yeah.
because you guys don't have, there's no problem.
We're great. Giant dicks too, with our gigantic.
Yeah. Huge. Yeah, no. I mean, it's like, look at, if we're nothing else, we are like very interested in health. I have 20 supplements here that I got a great reason for taking each one of them. And, none of them are ED, by the way, but that's, but
I'm
that's
sure
not
there's
these.
some side benefit of it too.
But like,
I mean,
if I do this because like at some level believe that there's this is optimizing this or that to either hedge for lifestyle choices that I've made or to hedge against aging in general. Like, I mean, there's all a bunch of reasons I have it. So this is one area, honestly, I've given precisely zero thought to, and I am definitely personally curious, but I can't be the only one for sure. Right. I mean,
I feel like I got to give more thought to it now. Honestly, I'm like, now I'm worried.
But maybe that's why I don't have any thought of it, because it's not like something that currently plagues me. So
It hasn't hit you yet.
Yeah. So like, I'm kind of like, now I'm like, oh shit, what if tomorrow's the day? I don't know, man. I'm very ill prepared.
Yeah, of course. And, and ED is like that. It's one of those things that you don't think about until you have a problem, right?
Yeah.
And until like you're trying to have intercourse and it just doesn't, you can't make it, or you're having intercourse and it just kind of falls short. So, so are there things? So, in terms of shockwave, in terms of pumps, there's no long-term research that says, all right, if you do this, right, then it's going to be able to prevent erectile dysfunction. But I personally think that these are things that you should be doing. Like, I think that, diet, exercise, probably the most important, right? Keeping a healthy lifestyle, most important. If you stay away from diabetes, you stay away from hypertension, all those things are going to be great. And it's going to benefit your penis, right? So, but I also think that, I think that, shockwave therapy may be something that can help. Like, for instance, for guys that are undergoing radiotherapy for prostate cancer, right? I pre-treat those guys, and I treat them during radiation with low intensity shockwave. We use pumps, right? We use PD5s because we know that the radiation is going to cause some damage to their penis. And in my anecdotal experience, these guys do better. They do a lot better, when we're treating them ahead of time. So I also think that guys, as we mentioned, who are younger, who are thinking about their erectile function, I think that using a pump is helpful. I think that it gets them to start thinking about their erectile function because they're using the pump. They're thinking about their erectile function, but they're probably more likely to exercise and eat well too because they're thinking about their erectile function. It's just another tool that we're using to kind of keep our sexual health and keep the longevity of it.
Yeah, I think we gotta do a deeper dive into the pump now. I think we're there. So
Yes.
this is like, clearly this is a home unit, but can you walk us through maybe like how you even recommend it, maybe how you expect patients to use it, and kind of what they could see from it?
Yeah, so there, when you talk about a penile pump or a vacuum erection device, those are two names that are kind of used interchangeably. There's two types, right? There's a pneumatic one and there's like a hydro one, which is with water, right? So the pneumatic one uses air and the hydro pump uses water. It's the pump's filled with water and then that creates a suction with a suction device. So the differences are with the pneumatic device, which is the air, right? Air is, when it's in the pump, at least this is what I've been told by scientists, some of the world's best scientists, that the air just isn't distributed equally amongst the pump, right? And so you don't get a really good distribution. And so you can get some petechiae, which is some little blood vessels. You can get some bruising. Where you have the hydro pump, which that hydro pump, the water is distributed throughout the whole pump equally. So you're going to get a better fill of your penis. Right?
Okay.
And you're going to avoid some of those ill effects. That being said, obviously, if you use a hydro pump for too long and you're too aggressive, then you may have some of those side effects, but it's not going to be as common, right? And so for the pumps, it depends. For me, it depends on the reason why the person's in the office. And so if, for instance, if it's a guy that I'm treating for ED and we're using PRP for the penis, then my protocol is they're, for at least 5 weeks, they're pumping twice a day, morning and night, with the pump. All right. If
And
we're
how
using
long
it for
is a
prevention,
pump session? Is it like 30 seconds, 10
so
minutes?
it's about 5 minutes. It's
Okay.
for that protocol, right? For my protocol for that.
And they're doing this, I'm assuming, in a shower or something.
They do it in the shower. Yeah.
Okay,
They do it in the
all right.
shower morning and night for that protocol. From other guys that are interested in more prevention, then they're also doing it in a shower. They just do it once a day. They can do it a few times a week, 2 minutes up, 3 minutes down. Right. And so that's kind of how.
Wait, with 2 minutes. Oh, 2 minutes to pump it up and then 3 minutes to
and then
descend.
they just, relax it for like 2 or 3 minutes and they're going to pump it up again, just a few times while they're in the shower.
All right. So when you do it with the PRP, sorry, do you wait? Because now my understanding with PRP is clearly not as advanced as yours, but I thought you didn't want to move those.
No, not for PRP. For PRP, this is when they get home. So
okay, all right, okay.
Yeah, so when they get home, we start using it. Yeah.
Okay.
So that's how we use the pump. And for prevention, it's a couple times a week, 2 to 3 times a week we're using it in the shower and the bath. Like I said, when guys are thinking about their penis, they're also thinking about their lifestyle as well, which is great, right? Because they're concerned about, future erectile dysfunction. So they're eating better, they're exercising better, they're doing all these other things. I use some nitric oxide supplements as well, just to kind of help them along and support their endothelium, which is the inner lining of their blood vessels.
Yeah, we talked about nitric oxide on this show about when people were doing cardiac health stuff. I know that's been, there was a brief, real high interest in nitric oxide supplements. And
I personally use beet powder as a pre-workout, I like that. Yeah.
Yeah. Beet powder is great.
So are these, when you're talking about, any of the supplement side of this, are these pharmaceutical grade stuff, or is this like herbal? Is it a little bit of both? Like, is there a pro?
I'm pretty simple. So I like L-citrulline. That's one of the things that I like in particular. So that's because it just metabolizes better in the liver as opposed to just taking L-arginine, right? Because L-citrulline gets converted over to L-arginine. And with L-arginine, if you take too much, then some guys who have propensity for having cold sores and everything, it may increase.
That's interesting.
So I like L-citrulline a lot better for those reasons.
Interesting.
For my nitric oxide.
When we were trying to get
all these other things that you can use.
Yeah. Now, do you like maca because it's kind of that hormone pathway precursor, right?
Yeah, I like maca. I do. I like, for me, I stick to a couple of things, and one of them is L-citrulline. I think maca. A lot of guys come in with like all these other supplements, and that's great, but I think in terms of nitric oxide supplementation, I think that's one of the best things that you can use.
Okay, all right.
Yeah, when we were trying to get pregnant, we couldn't get pregnant. We didn't know why, but so my wife, in her quest to casually Google search this, came back with a supplement regimen. I cannot for the life of me. My son's 15 now, so I can't really remember what I took, but it was like pine bark extract, aspirin, alpha lipoic acid, a green tea, and one other one, and garlic. And it was like on a thing all day. And 30 days after I did that, we did get pregnant. I don't know.
So it obviously worked.
It did definitely work. But the reason I asked about it is like that thing sounded like literally like a witch's brew to me. I'm like, seriously, who came up with this? And so I took it because I'm suggestible, and I was like, sure, none of this is a problem. It's basically just taking a lot of supplements.
Yeah, of course. But when you're dealing with fertility, you'll do anything,
Yeah, no, it was an easy lift for that. I'm like, I will be glad to take, $50 worth of GNC pills for the next 30 days. That's totally fine.
That's right.
Yeah.
Right.
So can I admit something here about penis pumps in general? I was under the impression that they were always advertised for enlargement.
Oh yeah, I totally thought
that's what I thought was what people were using it for, and I thought it was bullshit. Can you speak to that aspect of it?
Like maybe it's a different pump that makes you bigger. I don't know.
Which is the one that makes you bigger?
Yeah. So, I can't. I'm gonna tell you, I can't say that this pump will make you bigger. I just can't say that on label.
Yeah.
Right. But pumps. When especially if you're increasing blood flow to the penis, a lot of guys will say anecdotally that they'll have a little more girth and length. So
okay.
For a lot of pumps that would happen. Yeah. But I can't say on label that this pump is gonna make you from 5 inches to 12. I can't. I wish I could say that. If that would,
you'd sell a hell of a lot more pumps too.
Yeah. Your pump sales are skyrocketing.
I'll tell you.
Yeah. But it is funny. That's the only thing I've ever seen.
Well, Austin Powers had a whole bit about it. I remember the Austin Powers scene.
Yeah,
that's not my pump. How did that get in there?
So when we're using our pump with PRP, especially, a lot of guys will say that they have a lot more girth and length.
Mm-hmm.
And when I counsel other guys that are interested, I'll tell them that that's like a side effect of it. But I think it's the way that we do and we kind of administer our PRP that allows for that. So
I have not heard PRP in relation to.
I have, but that's only because I worked in like a trendy chain of wellness centers that was doing. I know they called it like the P shot, and then they had the O shot for women or something like that. And it was interesting, but not something I was gonna try out. But can you walk us through that?
Yeah, what's the thought behind PRP?
So it's off label for erectile dysfunction and for orgasm and everything. So what PRP is platelet-rich plasma. Once it's off label, just putting it out there.
Yeah, we've talked about it with joint therapies and stuff.
So it's the same thing, right? And so what it is essentially you have somebody draw your blood, right? And in our practice, we have like an FDA approved centrifuge, FDA approved kits. And what it does is it separates the like whole blood, and you get on one side of the container, you get these platelets, right? And so what are platelets? So platelets are this constituents in our blood that when you get an injury, what happens, those platelets go to that site, right? They cause coagulations to stop the bleeding. And then what they do is they release all these growth factors in these stimulatory cells that say, hey, listen, come on in. You need to heal whatever is hurt or broken or whatever, right? And so the idea behind that is that you're getting these platelets and you're putting in an injured site. So in joints, so a lot of the orthopedic guys will place it in shoulders and knees, right? To help with restoration.
Yeah.
Right. And so the same thing for ED. So we place it in the penis. The penis should be stimulated in some way. So I like to use shockwave therapy and all these other things before it. So we're getting those micro trauma,
blood,
right? And so that's how we do it. And we have a special protocol, even though for the P shot, I do it a little differently, but, and so we have a special protocol where we keep the PRP in the penis. And then we kind of, we release it. We use the pump and all these other things. And then, that's it. And then we just wait for things to work.
So how many injections are you talking about? And is it in the shaft? Is it in the head? Is it throughout the whole?
So that's where a lot of guys will place I'm a urologist, so this is the reason why I don't place it in the head. When you get an erection, what fills are the chambers on the side of the penis. You get a little fill in the glans, which is the head of the penis, but most of the fill is in the corpora or the shaft, right? And the glans is really vascular and it's painful. I don't place my PRP in the glands, and I don't think guys that don't really understand the anatomy should either, because you can hurt the urethra for some guys if you place the needle too far into the glands. That's not my worry, but for me, but I just think that, the vascular portion, so we place all our PRP in the shaft of the penis.
And how many injections is that in the shaft? Is it a circular thing?
I mean, technically you can, so in between the chambers of the penis, there are connections, right? So technically you can do one and you'd be fine, right? But most guys will do from 2 to 4 injections.
Got it.
So this is clearly with like a topical numbing something, right?
So I mean, if you do it correctly, I don't think you need topical numbing the way, if you are familiar with the anatomy and everything, but you can use topical numbing, you use like a lidocaine cream of some sort to place on the.
And
on
how
the
many times
corpora.
would one go back for this to repeat? Is it a one and done? Is it a therapy
So it
over
depends
time?
it depends on the degree of ED. If you have severe ED, like if you're on medications and it doesn't work, you can go to places to get it, but I wouldn't recommend it. I think you need something else along with it, right?
Mm-hmm.
Whereas if you have mild ED, then it may work for you alone. So, and then the more severe the ED, like the more times like you may come back in like 6 months or so. It just,
I gotcha.
that really depends on that person and the severity of their ED. Once again, like we said, it's like, not everyone follows that same protocol.
Sure,
everyone's different. And so like when I do my ultrasound and I look, all right, does this guy have an issue with getting blood flow to the penis, or is his issue with the blood flow leaking out of the penis? And then we look at, how much blood flow is leaking out or how little blood flow is going in. Then we kind of figure out what exactly we're going to do and what their protocol is going to be.
Right. So it seems
This
like
is
a little
really
like a
fascinating.
cortisone shot. Yeah. It seems like a cortisone shot. It's like, I'm something problem. I'm going to get this, and it might be the only one I ever need. I might need to come back again. Like I didn't even know they did that for ED stuff. So that is crazy.
Yeah, we do. We've been working on like these restorative things for a long time in our practice, and we also use just regular like treatments like Viagra, Cialis, and all these other things, and we'll use that to supplement some of the restorative things. So
do you find yourself getting people off the Viagra and the Cialis?
That's the goal. I mean, the goal for a lot of people is to either come off the Viagra, Cialis, or but I would say the majority of the patients are guys that the Viagra and Cialis just aren't working, right? And that's where they're seeing. I mean, because of the availability of like Viagra and Cialis on the internet and everything like that, guys are just getting it and they're just like, taking it like candy,
like
right?
Candy, yeah.
And so they're not really seeing a physician at that point. So we're seeing patients later than we were before because of the accessibility of all these medications online. Right?
You just answered a question I've had for a long time. You see companies popping up where they're like, oh, in 15 minutes, we'll get you Viagra. And I'm like, well, in my head, that's pointing to a much deeper problem. And you're just putting a Band-Aid on, to use a phrase,
Yeah. I try not to knock anyone's business.
I got you. Look, they're making money.
It's like, it's one of those things. And, I think it gives, guys a choice, and at least they're being proactive about their erectile function. I wish they would, I don't know who the doctor is on the other end of that, or whoever is on the other end, but I hope that they're saying, hey, listen, like, we're going to prescribe this for you, but, these are things to look out for. If you have any of these other symptoms, you got to go see a physician. I don't know if they're saying that, so I don't.
Yeah, they're definitely not.
Yeah, I don't know.
Hey, I got a question for you, because this has come up in other realms, but you stressed, emphasized, underlined, and bolded with a little highlighter the off-label moniker many times on this, and I think that we understand here why that is being said, but I guess my question really is why? I mean, are you with everybody else that just the industry is the government can't keep up with the speed of these advancements, and we're finding out all these novel uses for things that went through this laborious FDA approval process for one thing, but now, like, the whole planet's on Ozempic right now, right? Like, I mean, we haven't had any huger spike in diabetes that I'm aware of, but we got a lot of people that know they can shed a ton of weight. That's all off label too. So is this just another victim of that circumstance, or I mean, how is it so many off label things are being so productive in this field and not being on label?
I think it's the process. I think it's the expense of the process. Like, I think that, and it's the adoption amongst traditional physicians as well. So for instance, like, I was one of the first urologists in the country that really embraced shockwave, and everybody thought I was crazy, right? Everybody's like, shockwave. But you look at the data from other countries in Europe, parts of Asia, and it was working great. And so what I did is I purchased a machine. I went out and I did my own trial, right? I treated like 100 guys. I said, listen, come into my office. I'm going to give this to you for free. We know it's not going to cause you any harm, right? But we're going to develop our protocols behind it. and I had great responses. And the literature slowly caught up with it. And so now a lot of more people are using shockwave therapy, but I've been using shockwave therapy for like almost 8-9 years now. So a long time, right? But it just takes a while for traditional physicians to change their mind. I mean, even if you look at, say, prostate cancer, right? So everyone, for prostate cancer, we would operate it would be an open prostatectomy, right? And then this robot thing came along, right? And so there's people saying, oh, we don't need to use a robot. We're great surgeons and all these other things. And then slowly it was an adaptation it was an adoption of the robot. And now like every prostatectomy, every prostate that's removed, probably 99% of the prostates are removed by a robot, right? So it's a slow process. You know, the medical field is very conservative, and in some respects, I think we should be looking at technology. Our first tenet is to do no harm, right? But I think that some of it is driven by industry, obviously, right? Some of it is driven by the cost that it takes to take a machine or new technology to market. I mean, and you're talking about millions and millions of dollars.
No, of course, but I mean, who's driving the progress in these off-label experiments? And guys like you who said, "Hey, I heard a thing from a guy somewhere else, and this seems reasonable."
I mean, it seems like there's an understanding of the physiology as well as the method of action of the treatment, and then being able to apply that to a different situation.
Some of the first studies on shockwave was on the cardiovascular system, right? And then from there, they extrapolated and say, all right, well, it's helping with this. And so why wouldn't it help for the penis? They use shockwave therapy in athletics, right? For joints, shoulders. Like I'm sure in almost any Major League Baseball, back office, they have shockwave for their patients as well. Actually, I took care of a guy who worked for a Major League baseball team, and we were using CoreWave or shockwave on the penis, and he's like, "Oh, doc, I got something like this in the office that we use on our guys at the stadium." So they've been using it for horses as well for a long time. Just different energies, but just different applications. So for something like shockwave, you've been using it in a lot of different forms and a lot of different areas in medicine, and then now obviously on the penis.
Yeah, one of my favorite little things is actually a horse treatment, the PEMF coil from MagnaWave. Yeah, you put that thing around your neck and your whole body convulses, but like you do that for 20 minutes and I'm like, I never feel better than when I'm done with that thing, man. And I don't get a chance to play with it very often, but a buddy of ours has a very strange chair where that thing is built into it.
Very expensive, strange chair.
Yeah, very expensive. They're like $150,000 chair. But
is that it now? I thought it was up to $250,000.
Oh, was it? Oh, maybe it has gotten.
I don't know. Yeah. He's got one of them in a Airstream liner, and it's all decked out.
But they worked with MagnaWave directly, which is an equine PEMF, to make one for humans, and built it into a cast resin, zero gravity chair. It's amazing.
Bed,
and you've never felt better in your entire life being treated with a horse thing. So it's crazy. Cool, man. Well, I got to tell you, I'm a little embarrassed how little I know about my penis. I've been living with it for 47 years, and I never asked many of these questions. I'll be honest.
I think it's embarrassment too,
Well, I think most guys just haven't, right? I think that, we take it for granted, right? You're young and it works. It's great, right? You wake up and it's waking you up, you roll over in the middle of the night and it's just not there, right? It just slowly sort of goes away. And so we should be thinking about our penis, right? If we're thinking about our penis, that we're really thinking about we're thinking about our whole system, right? My friends who are cardiologists are like, oh, the heart is like the center of like the body, and like it's so important. I agree. I think the penis is too, like it's something that it's, like I said, it's sort of a litmus test. It tells us what's going on with our vascular system for a number of guys, not for all guys, for a number of guys. Right. And, if we're aware of it, if things aren't going right, then I think that it's time to kind of buckle up and really start being proactive or reactive at that point and starting to do something about it.
And just to give people a little hope, like when things do kind of go sideways and you got to kind of come see you, what Like what are general treatment windows from like bad to better or bad to great? Like, I mean, is this an easily fixed problem by and large? I'm not talking about outliers. I'm just talking about like down the middle average. Like,
Yeah, I mean, I would say like 98% of guys, 95% of guys can get better erections.
Oh, that's great.
It just
but like,
it
a
depends.
day, a week, a month, a year, like what kind of event horizon are we talking about here? Like,
You mean from when it starts to
yeah,
when
like
they see?
that was kind of like, is this a quick process to deal with? Is it a protracted experience? Like, I'm just curious.
I mean, for my office, like I tell guys, give me, depending on what the problem is, I say, give me 4 to 8 weeks and then we can kind of solve
All
our
right.
issue.
So reasonably
Well, that's
quick.
great. That's
Yeah.
that's
Yeah,
really that's
kind of
really
my
great.
window. That's my window for treating guys and really getting them back.
And you feel good after about that time that like, they're pretty much, at or near the finish line of treatment for now.
Yeah, I think they're improved. I mean, it always depends on what level they come in. So there's some
Sure.
guys that, there's guys, I had a guy that came in and he had severe ED, like really bad ED. And he's like, Doc, I want to be able to look at women and get a spontaneous erection without any medication or not doing anything. I'm like, well, I don't know if I can do that, but I can bring you back.
Should we be aiming for that?
Yeah, I mean, should I be? Like, I didn't know that was the bar.
Should I be like a 15-year-old again?
Yeah.
I mean, or
something we want. But I told him, I was like, listen, I'm not going to be able to get you there, but I can get you to the point where you'll be able to have sex again. We might have to like do a couple things to get there, but we'll get there. And I tell that to most of my guys, and like I said, we do such a full workup that, it's a combination of things. If your testosterone a little low, we're fixing that. If your estrogen's too high, we're doing that.
Mm-hmm.
We're adding nitric oxide supplements. We have some other things that we add. We're doing shock, whatever it is that we have to do, we're going to do it to get you to where you want to be. Right?
Is this health insurance covered? Like, how do people pay for this? Is it out of pocket?
Yeah. So I'm super specialized and I'm self-pay for my office, and which allows me, just like those MD VIP doctors you were saying, it just allows me to really spend time with my guys. So a guy comes in my office, our first consultation is about an hour.
Sure.
Like,
yeah. No,
we're talking about everything, right? We're doing nerve testing. We're talking about his experiences with his partner. We're talking about, what he's been on. We're going through his medications. We're going through everything. Right?
Yeah.
And then usually if they're not from out of town, they're local, then next visit I'm doing an ultrasound. There's some guys that I'll spend their first visit like 2 hours with them, and we're doing everything. We're doing the whole workup with the ultrasound and everything during that 2 hour period. For the ultrasound, I do give them a little bit of an injection. And we do that to get them to have an erection because I want to mimic what's going on in the bedroom, right? I want to see why they're having some issues. So that's the best way to look at blood flow. So
can I ask what you're injecting?
We inject, one of three medications. They're vasodilators.
Okay.
That increase blood flow to the penis. And so we want to do that because, I want to see if they have a leakage issue or if they're having difficulty with getting blood flow, or if they have like scarring of their penis, right? So you can have some scarring of your penis, which prevents the blood flow to going in or constricts it from dilating. And so you're not going to get a good erection that way if they have Peyronie's or whatever it might be. So we're looking for everything. So, but it's not, unfortunately, it is self-pay. I was a director at one of the hospitals in New York for a long time, and I loved it. And I got to see great patients, but I didn't get to spend as much time as I wanted to. I love spending time with my patients. I love learning about.
I can't imagine you can spend any amount of time with them if you're like any other doctor.
It's a lot hard, and not to knock that. It's just a lot harder to do that. And I just, for me, it just wasn't gratifying. And so that's why I started my practice here in Philly, and then I have a practice in New York, and I have another practice up in near the Poconos in Allentown.
Oh, cool! Wow, that's quite a spread. Any logic with those? I mean, New York, I get. The Poconos,
yeah, just
like
with that. The what?
Poconos is a little odd unless you're like,
it's a romantic.
Get some skiing in
getaway,
and do some
Matt.
patience.
I'm telling you, everybody says that, but I'll tell you, it's there's a lot of patients that need help everywhere, and
sure.
And so I'm in an area called Allentown, and so we spread out from like a guy drove like 2 hours from up north to come see me today, and I was really grateful that he did that. But it's just I think it's a great area. I think we get to help a lot of people out there.
I love
great.
that that's what you're doing, but I'd be remiss if I didn't say it's a sad testament that in order to get this level of attention, right? And I got to tell you, if I ever need to talk to a penis doctor, this is the conversation I want to have with the doctor that I'm, kind of interviewing for this, especially if it's a bad problem. I mean, then it's even more like I couldn't imagine having this squeezed into a 7.5 minute average doctor office visit. This would be impossible to gain any kind of usable information that amount of time on either side of the equation.
But it's not just with ED. It's like with so many other health conditions, right? It's just if you come in for a first time to see a physician and you have a number of medications, it's hard for them to go through everything, right?
Sure.
If you have diabetes, it's hard for them to counsel you. It's just that's again going back to the healthcare system and where we are, where the healthcare reimbursements are so low and physicians have to kind of crunch patients in order to pay light bills, and in order to kind of, pay these things off. So I think it's a general problem for healthcare in general. So
it's just unfortunate that I got to spend a couple grand a year to get a decent blood panel because the regular doctors won't do it. Right. Oh, and by the way, I also get a 3.99 longer hour physical doing this, but it sucks that that's the only path forward for that, right? Like that's the part that's really kind of, drives me crazy.
Yeah. I agree. I think we got to get some smart people involved and maybe it'll change, I'm hoping it's not going to get worse.
Well, Doc, thank you so much for coming by. Where do people find you? Let's talk about that.
So my website is rockwellcenters with an s.com. That's my site, and you can learn a little bit about me and all of the, at least I think, wonderful things that we do to help our male and female patients. For the pump that I like to use, that's exerciser.com. That's kind of my preference in terms of pumps that I like to use. I do some social media. I should probably do a little bit more, but it's at Dr. Gittens, like Instagram, and like I tried TikTok. I'm working on that, but it's taken me a while.
Yeah, not to say that anybody can't use more help, but you've been mentioned and referenced a lot. I was looking you up before the show a little bit. I'm like, you seem to be doing pretty good without the social media. So like,
yeah.
I'm not saying you don't do it, but you seem to be doing pretty all right for a guy not.
I also feel like if guys have a problem in this area, they're gonna dig.
Yeah,
they're
gonna seek you out.
Yeah.
I think that if you just like in our field, there and you said it's self-pay, and it's one of those things that I think there are some places. I'm not trying to make myself look whatever, but if you focus on treating people properly, right, and you do a good workup and you really care, I think those things happen, right? Obviously we're self-pay, but like it's not about that. It's about really giving good like healthcare or good men's health or whatever you want to call it. And I think that carries. I've been in practice since I started out in 2009, and then I was at a university and I came back, and so I think this practice has been open for like almost 10 years. I think when I opened this practice here, and it's just been great, but I think the key thing is you just got to be honest. I think you have to be moral. And I think you have to really provide good healthcare and listen to the patients. I think that's the key. And I think all those other things will come, So
no, I love it, man. We think very similarly here. So you kind of hit the nail on the head on that one.
Yeah, I'm very happy we had you on, man.
Yeah,
this has been great.
Well, guys, have a great. Thank you so much again. I so appreciated the time. Cindy, you didn't really talk a whole lot, but that's okay.
I let the boys talk about the future.
Yeah.
I deserve.
Yeah, gotcha. Well, thanks for coming. It was nice talking to you. So
yeah, guys. So
much
fun.
Enjoy the rest of the week, everyone.
Yeah, you too.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.